Bullying and negativism are a very common topic in healthcare management today. All the time you see articles, and at seminars you always have people talking about it. I don't need to go into the problems associated with negativism. You all know that. It's obvious. The thing that I really feel like doesn't get enough press coverage, though, is the true damage to patient care that it does. Truly, when people aren't communicating, and especially when people are fighting in the hospital, patients suffer. Looking for solutions, most people will do literature searches. All the articles I've seen fall into three categories. Category 1 are articles that just recite all the damage that bullying and negativism does, which is sort of obvious, we all know that. Category 2 are all the articles that basically say it's a really bad topic and it needs more research. Category 3 are all the articles that give hypothetical solutions, such as the hospital needs to take a stand, or you need to write a strict policy. What we need in healthcare is a cure for bullying and negativism, and that's what we've put together here. The central point is that bullying and negativism isn't just uncomfortable and annoying, it's a direct threat to patient safety, and it should be treated as such. Step 1 is you have to set expectations for the employees. The key to success is to be able to verbalize to the employees exactly the behavior that's unacceptable. We don't need more policies. What we need to do is to link the behavior to the policies that we already have. Hospitals already have all the policies they need, whether it's in the employee handbook or whether it's an HR policy. Every hospital already has a policy saying you have to respect your coworkers. The checklist is pretty self-explanatory. Negative behavior split into two sections, verbal and nonverbal. The categories speak for themselves. Complaining and whining, the person that there's always something negative to talk about. Ugly speech, where people are just talking trash, just general stirring the pot, trying to increase anger and gossiping negatively about coworkers. Direct arguing, where they're arguing with the charge nurse about their assignment or the manager. All forms of verbal personal abuse. You're stupid, you're a jerk. That's obviously against company policy. I like to include the non-personified abuse as the next category, where they just in general, I hate this place, or everything here is so messed up, or nobody here cares. It's still abuse, even though they're not directing it at a specific person. The final category, negative sarcasm coming at the expense of coworkers and leadership. I think a lot of folks, they're not really trying to be negative, they're just trying to be funny. But over time, it gets really, really old, and especially if they're a long-term employee somewhere, they're being a negative leader, and it really needs to stop. In the nonverbal section, it starts with actions where the supervisor is having to ask someone 4 and 5 times to get something done. Look, again, that goes back to we're not their parents, they're not children, we're partners here and they should act as such. The next section, purposely not participating in actions that require teamwork. This happens when you talk to someone about their attitude and they say, fine, I just won't talk to anybody. You know what? You don't get to do that. You do have to talk to people. You have to communicate. You have to collaborate, and you have to work together as a team to take care of that patient. And anything less is a direct threat to patient safety. The last section, injecting tension into the workplace, is a term I created to describe something that I found is pretty prevalent in healthcare. The two kinds are direct and indirect. Direct is malicious behavior directed towards others who act in a manner contrary to the employee's demanding expectations. So you're sitting there saying, hey, can you help me move this patient over right now? And the person doesn't really feel like being bothered. They say, so what? I'm supposed to get up and stop what I'm doing? Like what I'm doing isn't important? Is that what you're saying? Are they really engaging in a conversation about which work is more important? No. They're injecting tension in the workplace, so you go away and don't bother them. The indirect injection of tension in the workplace is really what's much more common. And this is just someone who's just exhibiting aggression. They're not doing it towards someone, they're not yelling at them, you're stupid, you're a jerk. It's just general negativity They're throwing clipboards across the room, slamming doors, stomping around. It doesn't even have to be a physical aggression. It can be pretending to do something physical, like pretending to punch a wall where they don't really hit it, but still they're clearly being violent. The person will say, I didn't hit anything, I didn't do anything, but yeah, they really did. And basically just running around, verbalizing anger, or this. They're injecting tension in the workplace so people back away, move off, and don't bother them. And you know what? That's not fair. We all have to come here to work. We all need to be all hands on deck. Anything less is a direct threat to patient safety, and it has to be addressed. Once you've educated your employees, step 2 is pretty easy. Once you get the complaint, you sit down with the employee and re-educate the expectations that you have for their behavior. You use this negativism checklist as an educational guide, but you always want to link the behavior to the specific policies that are violated. In a short amount of time, the reoffending employee will walk themselves out the door. One of the things we always say, frequent offenders frequently offend. So if they honestly can't control themselves and their negativity, this documentation will help you walk them out the door. But honestly, that doesn't happen that much. Most people can control their behavior, and once properly educated about the standards that we expect, they'll meet those standards no problem. Side note, how strict do you get with this? My rule of thumb is that, let's face it, we have a pretty hectic workplace. So everybody every now and then is going to sometimes be a little negative. So you don't want to be so harsh that you run everybody off. So my rule of thumb is pretty easy. 1 violation, they're having a bad day. 2 violations, they're having a real bad day. 3 violations, or a pattern of behavior, basically means it doesn't matter what kind of day it is, that's what this person does. And we have to address the pattern. With pattern people, normally when you do an investigation and really dig down with the people they work with, you find out that they've been doing this a long time. This is nothing new, and it needs to be addressed. Again, bullying and negativity in a hospital and anywhere in healthcare is a direct threat to patient safety. It just needs to be treated that way. This process also serves as a strong training tool for charge nurses and supervisors in company expectations. This is the kind of behavior that they should expect from staff. The process is easy to use, clearly understood, and it's made a big impact for me in my career. Positive employees get positive results. Now let's get out there and make the difference.